My name is Debbie Wade, and as a certified sex therapist, I get asked a lot of questions about sex. Two of the most frequently asked questions are, what is normal for frequency for sex? And what about low desire? These two questions usually are tied together because certainly desire is going to impact frequency. For the first question regarding frequency, there really isn't a normal. But if couples are arguing and struggling because one seems to always want sex and the other seems to never want sex, then there's a problem that can create stress, and that needs to be worked out. Couples need to learn to talk about sex and what their desires are and learn the art of negotiation. The one with the low desire may need to look at the causes. And it is not always the woman in the relationship with the low desire. Now, low desire is the most pervasive problem for couples. And in those cases, about 25 to 30%, it is the male with the low desire. Now, I know that's surprising to some of you because you've been told that men think about sex all the time and that men need sex at least 3 times a week or something's going to explode, fall off. And certainly this can be really confusing for couples. I know for women, they kind of go through a battery of questions. They will ask one, am I not sexy enough if he's not desiring me? Is something wrong with me? Then they may ask, the second question is usually, well, then is he having an affair or struggling with porn? Is that why he has low desire? Then the third question may be, is he gay? Is that why he hasn't desire? And then they get really frustrated, and the fourth question is usually, then what's wrong with him? Low desire for men or women could be due to many things, and those causes need to be looked at. From testosterone levels, hormonal imbalances, it could be about depression, medication, unresolved shame and or guilt, unhealed wounds from trauma, possibly because of physical difficulties, fear of performance, exhaustion, stress, lack of attraction to the spouse, lack of emotional connectedness, lack of enjoyment in sex, or simply negative beliefs about sex. But all of these causes for low desire should be addressed. Certainly the high desire spouse may also need to look at realistic expectations. Is the frequency that they're expecting, is that really realistic? Has sex become more of a demand than a sharing experience? I love to help couples learn to have healthy dialogue about sex, to develop positive attitudes about sex, and develop realistic expectations about sex. What you see in movies or have seen in porn is not real. We have so allowed media to impact our expectations about sex, and it so amazes me. We can go to a James Bond movie and know that everything about the movie is unrealistic and fake. The fast getaways, the shooting, the driving, the cinema photography. Yet when it comes to the sex scene, we go, now that is real. That is how it's supposed to be. Women may ask, why didn't my husband love me like that? Or men will say, why is my wife not hungry for sex like that? Realistic expectations about sex and positive attitudes are so important in developing a healthy relationship because it does impact desire or frequency. It takes a take and give from both the spouses, and it requires communication and connectedness. If you and your spouse are struggling sexually, I encourage you to get help from a certified sex therapist. For those who are Christians and desire godly instruction, there are certified Christian sex therapists. You can go to my website, debbiewade.com or actstherapy.com. I have information for myself as well as recommendation for other Christian sex therapists. Don't let sex remain a crisis in your marriage. There is help available and hope for developing a healthy sexual relationship in your marriage.